Yeah, hi, this is Dr. Ashesh Bhumkar. I'm an ENT surgeon based out of Thane. Regarding certain tips and tricks about specifics about for a surgeon, I think the first and the most important tip that I can think of is actually having the right instrument for the right job. And in my several talks, I have emphasized that you cannot eat or drink your soup with a fork. So you need an appropriate instrument for an appropriate step. This is, I think, it far before your surgery. It all begins in your infrastructure. So equipments are what drive excellence. So having the right equipment, never to crunch on buying equipment, investing in equipment, because they really are an extension of your body parts. This is something that I think every surgeon should keep in mind. Uh, Having the right instrument for the right step is very important. Keeping on buying, there's a tendency to use and overuse an instrument. There's a certain lifespan that an instrument has, and when its best is over, it is best to change the instrument. One of the biggest mistakes done at the junior level is to think that once my practice becomes big, once the volume is big, then I will invest in good equipment. It should exactly be the opposite. That when you are in your early learning curve and early practice, you should invest in, I'm saying not spend, but invest in good instruments and equipment, because only then can you do good work, and when you do good work, you get more work. It's not like you have to wait for more work to do good work. So this equation of good and more, the good work has to precede the more, and therefore these equipment are very important. Regarding the handling of the instruments, it's something which I say that ergonomically, where your body does not get fatigued, each one has his own, just for your shoulder position, just for your elbow position. It should be the least stressful. If you are going to do a surgery for 3 or 4 hours, at the end of it, none of your body part should be sore, and that is the ergonomically. For individual, it is all very different, but trying to find that position is very important. And anything that you need, maybe an elbow support, maybe a sandbag, something that supports, especially for us ENTs where we do a lot of microsurgery, having the stability of the hand and doing anything to make the hand even more stable. And in that, it could be fitness to increase your muscle tone and your endurance, or taking external devices to support your hands. These are very important. And the mechanical actions of a surgeon's stroke, I divide them into the fingertip actions, the wrist actions, the elbow action, and the shoulder action. And each step, especially in otology, in micro, even the curate removal, I think it involves steps at different parts. One has to be a little alert about these tiny things. When you are curating near the chorda, how it just moves at the wrist level and things like that. So when you are watching the masters or when you are watching your seniors, watch how which part of their hand is actually moving and how they are controlling that micro step. This is important. Regarding the scalpel, I think two things to look at how the instruments have to be dealt with. One is they have to be thought of as a painter's brush, and the second is to use them as delicately as possible. And the second one, which I really firmly believe, is to see them as an extension of your fingers. That is something which, had your finger been that much and of that instrument, how gently and how nicely you would have used it for the best efficient surgical output. This is something which I would like to share with you all. Besides this, I think so preparation beforehand. Regarding suturing, I think a lot is spoken about. A suturing is actually a surgeon's visiting card. How evenly placed are the sutures? There's aesthetics. It's not just about like suturing a mattress. In suturing, each suture has to be equidistant from the other. When your assistant is cutting the suture, they all have to be at the same level, not one large, one long, one the second one. They all. It speaks about your aesthetics. It speaks about your bar of excellence. So the way incision is sutured speaks a lot about how committed the patient, the surgeon is to a certain level of excellence and aesthetics. So all these have to be kept in mind. They speak about what happens under the skin, nobody can see, but you are judged by the way you have sutured, and it's also the right thing to do. So these are the few points that I would like to bring forth on this platter here. I have to thank Alchem for the initiative that they have taken about this fine details to be brought, because the devil or the god is only in the fine details. And I would like to thank DocMode for the educational platform they are providing for such a great initiative by Alchem. Thank you very much.